Hey, it's Dr. Heath Richter with Fairview Medical Group Orthopaedics, and we're going to talk to you a little bit today about some rotator cuff problems and how we treat those with surgery. You can treat rotator cuff injuries non-surgically with therapy, but if that fails, then surgery, and we'll show you how we do that surgery. Your rotator cuff is a group of muscles, very small muscles that are underneath sort of the bigger muscles that you can see regularly on your shoulder. And they originate most of them on the back part of your shoulder blade. If you can reach behind your shoulder, you can feel that hard bone that runs across the back of your shoulder, and that is actually the spine of your scapula. The two main muscles that we talk about with rotator cuff are called the supraspinatus above the spine, supraspinatus, and infraspinatus below the spine. There's also the teres and the subscapularis, which are two other smaller rotator cuff muscles that can be injured, but typically we see supraspinatus tears. Now those muscles originate on the back of the shoulder blade, and then just like this badge here, they come across the top and they insert right out here on the outside part of the ball of your upper arm or humerus. So people come in, they'll have pain over here because that's right where these rotator cuff muscles insert. Now what happens is when those muscles over time become damaged, they get torn and they retract off, and that prevents the muscles from serving their function, which is to help keep this ball from riding up and pushing up. And so those muscles are also rotators of your shoulder, so people will oftentimes come in with weakness in their shoulder. You can develop rotator cuff problems over a long period of time from just wear and tear. We see that quite regularly. Or you can develop a traumatic big rotator cuff tear. We see that oftentimes when people have falls or motor vehicle collisions, or quite frequently, honestly, from my dog snatched the leash or something like that. And they'll come in, and those folks will have an acute inability to raise or move their arms. So when we see a traumatic large cuff tear, those people typically can't move their arm very well. When we see cuff tears develop from degenerative tearing over longer periods of time, those people are generally able to move fairly well. They just have quite a bit of pain. Now, the symptoms that we'll typically see will be pain in the shoulder, particularly along this area over here, and sometimes down into the biceps muscle, because your biceps muscle does actually go up into your shoulder. That pain will be worsened with forward elevation of the arm and rotation. People will frequently complain of an inability to get to the back of their head. For women, we see that become as an inability to get to the back there to do their hair, or to get back behind their back to fasten their bras. And they actually will complain of that quite frequently. For men, it's just trying to reach behind them to get things. People will say when they try to reach back behind into the seat in their car, they have a lot of pain with that. It also causes quite a bit of pain at nighttime. When you lay on that side, it hurts. When you lay on the other side, it wants to pull across, and that hurts as well. So it's very difficult for people that have rotator cuff problems to get comfortable at nighttime, and honestly, most of them end up sleeping in a recliner before or immediately after surgery in order to try and relieve that pain. We can treat that with anti-inflammatory medications. We can do an injection behind the shoulder. We come in up under this bone here and put that medicine over the top of the rotator cuff. And we can put those people in therapy to strengthen up their muscles. If that doesn't work, then we typically will get an MRI to verify that there is a torn rotator cuff. And if they failed those conservative treatment things, then we will suggest that they have surgery. Now, what we do for surgery is we make a little incision back here on the back of the shoulder, and we have a camera. We can come in and we can look in here. Where the ball and the socket come together, we initially come in and we look in there, and we can look up at the bottom surface of the rotator cuff. Frequently, it'll be torn over in this area, and we can see that. We clean up around in the shoulder, and then we can take that camera and redirect it over the top of the rotator cuff and come in right up underneath this bone here, and we can see that tear from the top. Then we do most of our work from this area over here. We make a little smaller incision in the front of the shoulder so that we can get in and do some work up here, and then we typically will make a couple of small incisions over here on the outside so that we can come in. What we do is where the rotator cuff is torn off of this area right here, you can see that as on this tube, as two blue dots on this skeleton. And by the way, the skeleton, that's the insertion of these muscles. So the infraspinatus muscle inserts here. The supraspinatus, remember we said that's the one that's most frequently torn, inserts here. Those two blue dots are actually really good for explaining this to you, because what we do is we come in and right where those insert, we clean that area up and kind of roughen that up, and we drill a hole right there, and we put an anchor into the bone right there. And that anchor has stitches attached to it. So once it's anchored in the bone, we'll pull real hard on it, make sure it's not going anywhere. Then we can take those stitches and we can tie them into the muscle that's there, and we pull that muscle back over, and we want it to come right back down where those blue dots are, because that's where it was supposed to be attached to start with. Again, remember, we're doing all this with a camera from back here and instruments over here. So you've only got typically 2 or 3 very small, one or two stitch incisions. while we're doing all this. And we can see all this, we're looking with the camera. Again, we drill those holes, put those anchors in, and have an instrument that passes those stitches, and then we tie those knots down, and we can still look at this and make sure that that rotator cuff is then pulled back over and attached where it's supposed to be attached. Once that's attached, then your surgery's over with, and we kind of clean up the rest of the shoulder, and we put you in a sling that holds your arm out to the side. When we hold your arm out to the side, you can see that it moves this closer to this, and that takes tension off of what we fixed. We don't want you pulling your arm back, and we don't want you taking this arm and rotating like this, because that puts a lot of tension on your repair. So to start with, we typically will leave you in that sling for 4 to 6 weeks, have you do just some what we call pendulum exercises, where you just keep some minor motion in your shoulder but without putting stress on what we fixed, and allow that to kind of heal. Once we've allowed that to heal, then we'll get you into physical therapy, and we can get those muscles strengthened back up. Now, again, rotator cuff muscles are small muscles, and they take a while to strengthen up. And so typically we say 6 months to a year to really get back to 100% strength after rotator cuff repair. It's been my experience that around 6 months we get you back to about 75 or 80% strength. A year to kind of get back to around 100% strength. Pain typically is better fairly quickly once we get your motion back and get the stiffness out. So therapy is a key component of this, both before surgery and after. But once we get that rotator cuff fixed, typically you can get that strengthened back up, and we can get you back where you're not hurting all the time, and particularly get that nighttime pain resolved.